your mic come up with?
Yes.
Okay.
Yes, I'm sorry.
No.
That's what I put usually. Got some heavy duty power going in here today too.
Sorry, this is my shortest stand I have.
That's okay.
I'll try to keep it like on the edge.
That's fine. I'm good. I haven't gotten any taller throughout this. I haven't. Yeah, my stool's over there, but I don't like that one. Everyone good? Good? Good afternoon. I'm Dr. Sandra Martell, the Public Health Administrator for Winnebago County, and I'm joined today by Mayor Tom McNamara. I know it's been a while since we've had a press briefing as a group. We've been doing much more individual, but I think it's important today to start to talk about what we call demobilization as we prepare for Phase 5 Restore Illinois. As you've heard the governor speak to it, our metrics are trending in the right direction for the state of Illinois to move into Phase 5 on June 11th. For Winnebago County, the numbers are trending in the right direction. Today, we're reporting new cases of 23. Our positivity rate is down below 5% at 4%. We've had 7 consecutive days of patient decreases in hospitals. And we've had 4 consecutive days of more than 20% capacity available in our ICUs. But COVID is not gone. We are learning to coexist. We have 2 locations of concern, Fair Oaks Rehabilitation and Healthcare Center and Walter Lawson Children's Home. But vaccination has been a game changer for us. At the present time, we're reporting approximately 37% are fully vaccinated, and 51% of the eligible population has received 1 or more doses. But we have a ways to go yet, and we have some areas of our community that we will need to work to increase vaccination rates. But during this demobilization phase, Winnebago County Health Department and Winnebago County will start to scale back emergency response activities and return to more routine operations. I hesitate to call them normal, but routine. So during this phase, we will start to scale back some of our mass vaccination clinics. Effective June 12th, the community vaccination site at Sandy Hollow will cease operations. Many of the Illinois National Guard and contract nurses will be returning home. We are grateful for their support in vaccinating our community, and if you see them about, please thank them for their services. We wish them a safe return home and to return back to our region as visitors and not vaccinators. The community vaccination site at New Zion will continue to provide vaccinations throughout the month of June. It will operate Tuesdays, Wednesdays, Fridays, and Saturdays, and we'll put those together for you, from 8 a.m. to 12 p.m., Thursdays from 4 to 8 p.m., they'll be closed Sunday and Monday, and we'll explain a little bit why later. Walk-ins will be welcome, and all 3 vaccines will be offered. As we get toward the end of the month of June, so we're looking forward as we continue our demobilization, vaccinations will be offered at the Winnebago County Health Department in this building, and will continue throughout the months of July and August, on Wednesdays from 4 to 8 p.m., and Saturdays from 8 a.m. in the morning to 12 p.m. in the afternoon. Individuals needing second doses who received their first dose at Sandy Hollow will be offered appointments at any of our available clinics. We are transitioning to smaller scale vaccination sites throughout the community focused on our communities of concern and other locations with lower vaccination rates. We're calling it our Destination Vaccination Campaign. With the support of RMTD, the Winnebago County Health Department will be operating with a mobile guard unit to continue our Vax Up campaign, hashtag VaxUp815. Stay tuned for the big reveal next week. Look for our bus at the community events. If you have an event that you would like us to bring the bus to provide vaccinations, please contact the COVID-19 hotline. We will also continue to offer a variety of incentives throughout the process to encourage vaccination. As you know, we've tried a variety of things. We've tried food trucks, we've tried bans, and we have also been lucky to receive Six Flags Great America tickets. We will be providing a family fun pack of 4 tickets to the first 50 individuals less than 18 years of age who are vaccinated at select community events. These tickets will be good for admittance at Great America Gurnee, Hurricane Harbor Chicago, or Hurricane Harbor Rockford, formerly known as Magic Waters. We will limit 1 per household. Stay tuned because those will be kind of flash events and to let people know that we are vaccinating in their community. We are with President Biden to set that national goal of 70% of our population having 1 dose before the July 4th holiday. We are going to continue to have to practice some social mitigations, both vaccinated and unvaccinated. We are going to continue to practice frequent hand washing and sanitation. If you look on our website for our communicable disease reports, you can see diseases associated with hand washing have decreased significantly throughout the pandemic. Let's continue our track record. You must stay home and isolate if you become symptomatic for COVID-19, whether you're vaccinated or unvaccinated, and get tested if you become symptomatic. The testing site at Sandy Hollow will continue to operate. In addition, we now have testing available at the University of Illinois College of Medicine on the alternate days. You can see our website for connections about where testing is offered to the community. If you are unvaccinated, you must wear your face mask both indoors and outdoors when outside of your household and when traveling on public conveyances. That means if you pick up an Uber, if you ride an RMTD, if you're on a plane, train, automobile, as we say. And you must maintain 6 feet of social distancing. And if you're exposed to COVID-19, you must quarantine. If you are vaccinated and fully protected, meaning 2 weeks after completion of your series, you do not need to wear face coverings unless you are in a healthcare environment or traveling on public conveyances. Again, you have to wear them on plane, trains, automobiles, Uber drivers, Lyft drivers, any kind of a public conveyance. But you do not need to maintain 6 feet of social distancing, meaning hugs and handshakes are welcome. And you do not need to quarantine if you are exposed to COVID-19. As we prepare for this process, business, employers, and vaccination, we're hearing more and more about as businesses return to full occupancy. The Equal Employment Opportunities Commission issued guidance that businesses can require their employees to be vaccinated COVID-19 without violating any federal law. Check with your employer regarding their vaccination requirements. And businesses can set their own policies regarding masking requirements. As you walk through our community, you'll see signs up with their policies asking you to please wear a mask until you're seated, or wear a mask when a server comes in, or we require masks for your personal services. Know the policy of the business before going and be prepared to wear a mask if required. And I can't keep stressing enough, it's not too late to vaccinate, but more importantly, don't wait to vaccinate. The other area that people have been asking about as we kind of get into the end of the school year are school updates. So planning continues with the Regional Office of Education for Winnebago and Boone counties, our regional superintendents, and RPS 205 for the return to full in-person learning for the 2021-2022 school year. Vaccination of eligible individuals age 12 and over will be the key to reducing the transmission of COVID-19 in those environments and disruption and return to remote. Because as we've talked about, if you're unvaccinated, you will be required to quarantine. And it will also be an opportunity, if you're vaccinated, to increase the extracurricular activities that make school a bit of fun while you're learning. We're talking about the sports, the dances, the celebrations, the graduations, the things that you've all missed. I want to congratulate our class of 2021. You've been through a year like no other. You have demonstrated perseverance, flexibility, and resilience. You have made history. We wish you continued success wherever your journey takes you, college, career, trades, and we are very proud of you. I want to thank our educators and school staff. I know it was hard on you in the beginning, but you too demonstrated perseverance, flexibility, and resilience, and we are also proud of you. I want to give a special acknowledgement and thanks to the school nurses of Winnebago County, who have assisted throughout the pandemic to keep the in-person learning environment safe for students and staff. From the start, they worked on exclusions. They were the ones who took the heat from the parents when they called to say your child is exhibiting symptoms, come get them. Testing, they learned how to do testing in the school environment so that we could test for COVID. They did a lot of work on contact tracing, isolation and quarantine. And then when the time came, they stood up to vaccinate. They indicated and they said from the beginning, we will vaccinate our staff and we will vaccinate our students. I want to wish all of them a very restful and well-deserved summer break. And with that, I'm going to turn over the remarks to Mayor McNamara.
Thank you, Dr. Martell, and I know you just gave out a lot of thanks. I just want to, again, just say thank you to you and your entire team here at the Health Department for your tireless efforts and your perseverance throughout these last 16 months. It's really been remarkable, and we're fortunate to have you. Like many of you who are watching or will be watching this, I am absolutely thrilled that we're continuing to reopen and get Rockford back to rebuilding, and for some getting back to a new sense of normalcy. I too want to share my tremendous thank you to the National Guard, who will be leaving on June 12th, and just say sincerely thank you for your service to the country and to our community. It really is appreciated. So as we've mentioned, we're starting to rebuild, reopen, and I think we have to underscore there's still a lot of work to be done when our city and in Winnebago County here locally only has 37% of our population that is fully vaccinated. The health department has tried tirelessly a whole host of different tactics, and Dr. Martell mentioned a number of those, and these tactics have been accessible and they've been visible. They've been pop-up vaccination sites. They have been partnering with schools and businesses, offering incentives to individuals and families to receive their vaccination, but there's still obviously some hesitation among many community members. I want to make sure that I do my part. So I just recently signed on to the Mayor's Challenge to increase COVID-19 vaccinations, which is led by the United States Conference of Mayors in conjunction with President Joe Biden, the White House, and the U.S. Department of Health and Human Services. That challenge has been accepted by 56 mayors across the country. And right now, nationally, we want to get to 70% fully vaccinated. And right now, we have about 51% that have one dose and about 41% that are fully vaccinated. So over the next several weeks, I'll be working with mayors across the country to increase the visibility the visibility and the importance of getting vaccines. As Dr. Martell said, it's absolutely been a game changer for us here locally to help us keep those numbers under 5% and new cases in the 20s, and having more availability of beds is really remarkable. So I would just say a couple of things. If you have been vaccinated, thank you. Thank you for answering that call, just for your own health, for your family's health, but also for our community. I want to say, please encourage your family members, your friends, your neighbors, anyone you come in contact with. Share your experience of that vaccination, because I think when you share your experience and share why you got vaccinated, I think that's important to encourage others to get vaccinated. And obviously, I'm fully vaccinated, and there was a host of reasons I wanted to get vaccinated. One, it's hard to come to these press conferences every day and tell you to get vaccinated if I haven't. Two, and very personally, is I have two amazing kids, and I want to make sure I'm doing everything I can do to protect them and protect my amazing wife. But I also have a mother who is part of our more experienced population, and I want to be able to have the opportunity to go to her home, give her a big hug, tell her I miss her and love her, and not have to have that fear and that concern and that weight over your shoulders when you meet loved ones. And so I would encourage everyone, please take the time to get vaccinated. The more people that get vaccinated, the harder it is for COVID-19 to continue to spread. I would encourage you to continue to register online for your vaccination. It's not mandatory. You can register on site, but it certainly makes the process easier and faster. So I would encourage you to go to wchd.org and get registered. You can still call the hotline. It's 815-319-6705. Again, you can register in advance, which makes it faster and easier, or you can register on site, and walk-ins are welcome. As we continue on our path of complete recovery and reopening to phase 5 as early as next week, I want to encourage everyone, make sure that you get out and support those local businesses. They're still certainly struggling. They still are in need of your patronage, and ask that you get out and really make an effort to go to the local business. Something against big box stores I have, but go to the local business. Help them out. Those dollars go farther and stay here a lot longer when you shop locally. Last thing I would mention, we have a lot of people who are still hurting. A lot of folks who still are struggling to pay that rent payment. And the City of Rockford has an emergency rental assistance program to provide assistance, and you can call 844-710-6919 or go to erap.rockfordil.gov to receive that assistance. Thank you.
I have a quick question. Sure. Just quickly going back to the ceasing of operations at the City Hall location and focusing on the areas of concern. I may have missed this, but I just want to make sure I heard clearly. So is there a goal to get more vaccination pop-up areas in the community? Is it going to be solely focused on this mobile bus that you mentioned? You know, what does that look like for people who may be concerned?
So the question is, as we demobilize the mass site, what that's going to look like. We anticipate using the bus for locations just to kind of draw attention, but we will continue vaccination efforts in buildings, and this week we launched off the Homebound vaccination campaign. So there was a team that went, and we'll call it a goal and a chaser. We would go and vaccinate, and then we'd have an observation person stay back with them and move forward. So we continue through that process. It could be in the schools again. The YMCA has also requested partnership, and we will be working with them. The idea is to offer it in a smaller scale in many places. Local businesses, I know that our communities of concern are looking at some of those smaller footprint businesses, barbershops, nail salons, any place. We're going, you know, when we first started out, we were going goals of 2,000 a day, and now we're going to be much smaller. Maybe it's 20 in a location, but that's 20 more individuals in our community that have gotten vaccinated that may have not considered it. Sometimes it requires, yeah, I hadn't really thought about it, but now that you're here, you know, I think I'll get it done. What we're also finding is oftentimes our children are helping lead the way as well. That they want to return to being able to see their friends, go to summer camps and day camps and playground activities. Those kinds of activities require vaccination to help fully protect the community. So we understand when we talk about hesitancy, for many of you who have asked me about before, it's not just about, you know, they're just not anti-vaccinators. It's just, I've been waiting to see how everyone else went through the process, just hadn't gotten around to it. So you see, you know, some of the pharmacies from the President's Initiative will be 24 hours. You know, you can walk in anytime. We are going to try and make it as accessible as we can and make it some, as we said, some fun, you know, making, as we say, destination vaccination, whether it's at a festival, whether it's at a neighborhood block party, a children's park, wherever we can kind of pop it up, get it done. The more that we can do this, the closer we can get to that 70% plus being fully vaccinated. That will protect all of us.
And are you, like, I guess, scaling back things because less people are coming out to get vaccinated, or because we've reached the point of being 41% fully vaccinated that you're confident we'll get higher and higher?
Well, I think the question is, are we scaling back? Well, we're really not scaling back. We're scaling differently. So instead of one large site, we're going to go out and do lots of littler sites, right? We know that the demand, that first group, especially, and I want to thank our seniors, I'm going to call them the 65 and older, you have carried us on the percent of population vaccinated. Because I find both the young, the 12 to 15-year-olds, and the senior 65, what is the motivator for all of them? They want to get out. They've been, really kind of isolated during all this, and they want to go out and hang out with their friends. They want to go out and play their games. They want to go out and visit, with family members. So I've got those two groups that are very motivated to get vaccinated. And then we've got the middle group that maybe we didn't have to stay in as much. We were their essential workers, and we kind of moved around our day, and we didn't really kind of take it into. So now we've got to get that group to help carry us on that vaccination. So what you're going to see is a different kind of strategy, right? We talked about this earlier, if you remember, go back to some of the early feeds about phases of vaccination, that we knew we were going to scale up when vaccine supply was low, right? So we started small in the healthcare systems, then we expanded to the mass, and now we're kind of going back and scaling into smaller venues where it's going to take more personal outreach. And really, kind of all of us, if each one of us brought in 2 to 3 people, ideally 5, we could increase the percent that we vaccinate. Sharing those experiences, I know they were looking for all of us to get an extra head or an extra eye, or, how sick were we? How many weeks did we have to take off from work? People ask those questions, be honest and real, but be honest and real about why you vaccinated. And similar to all of, I think many of us, I wanted to be able to see my mom. I wanted to be able to get back out in the community more to do some of the work that I needed to do. And I knew that if I was at risk and potentially brought it back into the workplace or any of that, that I exposed others. So it was extremely important to me, as well as to lead by example. We now have 6 months worth of data on these vaccines. So any fears that people have had about, there wasn't enough science behind it, I'm waiting for everyone else, your turn has come now. And so we need to get you vaccinated.
You touched on this already, but for that 4th of July holiday and wanting that goal of 70%, where do you think Winnebago County could fit in that, trending for the 4th of July holiday?
So the question is, where do I think we could fit? I think, this is we're a competitive community, right? We like a little bit of a challenge. I can't, I think we should be going for it at full steam. We should be using every resources. Our hospital partners and our healthcare systems are still vaccinating. All of our pharmacies are still vaccinating. We've got all kinds of pop-up events where people can access vaccine. There is no reason why we can't get there. It's a matter of choice, and it's a matter of all of us collectively moving together so that we can all be on the Jefferson Street Bridge and the Morgan Street Bridge as those fireworks go off without worrying about, am I socially distanced, who's wearing a mask? We can be there together.
Can you give us a little bit more insight into the Sandy Hollow vaccination site? What were the numbers? How did we make the decision to close it, or will close it on June 12th?
So the question is numbers. How do we make the decision? Well, first of all, the numbers have been dropping for individuals that go to that location. When we started out, I remember every day we'd have enough vaccine to cover 700, 800. We were close to 2,000 for a couple of weeks. And now we're starting to see about 200 to 300. And so we started to say, okay, where else can we vaccinate? As children were put on, in the 12 to 18-year-olds, we started vaccinating in the school footprints. So we were at RPS schools. We just will be doing second doses up in the Winnebago, Peck, and Durand area. We did the Hononegah in the north end, South Beloit. So the idea was going more where we could capture the individuals, make it easier for them to get vaccinated. And so, again, we're starting to look at different strategies. So the mass site, people are, not using it as much, and so we said, let's move our resources in a way that we can move them around and be more nimble to really kind of take advantage of all the summer festivals and activities that we have.
And then that testing site will stay?
This testing site will remain in place.
Okay, and then people can go to the new Zion, Missionary
And
Baptist Church for vaccine?
Correct. We are committed to maintaining that site as another mass site through the month of June. Again, for individuals who received their first dose at Sandy Hollow. We still have a lot of individuals who received a first dose outside of our county that are looking for second doses. I don't want them to think they can't go anyplace. They can walk into the New Zion site as well. And then we'll transition, because they're going to be bringing their faith services back into operation by the end of June. We'll start bringing them into the health department at that time. But pharmacies will also be operating. We'll still be out in the community vaccinating. And we'll be looking at other larger scale events and activities to bring people in for vaccination. And you're going to bet that we are going to be doing a big push back to school as well. Not only for COVID-19, but remember, we have many children that may have missed their routine childhood vaccines required for school because they were not in the in-person environment. So we're going to get everybody ready to return to that environment.
So is the New Zion going to close at the end of June?
It is anticipated that they will start to scale back hours because they will be bringing back their faith-based worship services into the in-person environment as well.
Okay, so just scaling back hours.
Mm-hmm.
Okay.
Do you
And-
know, oh, sorry, go ahead.
One question, so for the mobile bus, did you say that people can actually get the vaccine on that bus, or it's just?
Oh yeah, they'll be able to get the vaccine on the bus. We'll do a big reveal and show. I think you've seen many communities have moved on that. I said I'm going to say RMTD was a partner from the get-go, and we'll be talking more and taking on a tour of the bus. They were a partner that when I called, several weeks ago and said I need a bus, I wanted to be able to travel around. Someone asked me where I'm going to park it. I said, not to worry, I've got a driver for that, and they'll make sure I can park. Because again, we know that first of all, we've got so many events where we have food trucks and people gathering, to bring that up and say, hey, you can get it right now. We can help register you. It's going to have Wi-Fi, so we can register you online. So if maybe you didn't even think about that. I appreciate the mayor's comments about pre-registration. It makes life easier. But hey, we're now knowing it's not, I'm going to say it's not the easy, everyone shows up. It's going to be really hand-to-hand, personally bringing people into that, that situation. So some places it may be that the bus is co-located, right? So if we have a big building and we can use that, it may be that we vaccinate on the bus and you bring a lawn chair and we'll sit you out in your lawn chair for 15 minutes and monitor you. We may be driving it down a neighborhood block party. The idea being we're going to go where people need to be vaccinated.
And when can we anticipate to see this bus, or when will it start operating?
We plan the big reveal for next week.
Do you know offhand how many doses have been administered in the county total?
I can get that number for you. Are you talking just about, the question was, do I know how many doses in total? Well, there's two different numbers. I can tell you the numbers that have been administered in collaboration with the health department, then total number of doses that have been administered throughout the county that's reported on the state website. And then if you wanted specifically what's at Sandy Hollow versus, some of our other locations, we can pull that as well. So we can get that number for you.
And so the percentage of the county that's fully vaccinated, is it 37 or 41?
It is at 36.6% as shown on the website today. And 50.6% of the eligible has received one or more doses. So we got a ways to go yet.
I guess one other question for you, Dr. Martell. Is it hard to believe that we're kind of getting to this point where we are rolling back a lot of these restrictions? We're going to close a mass vaccination site. Is it hard to believe that we're getting close to the end?
The question is it hard to believe we're getting close to the end? First of all, I want to dispel the myth that we're close to an end. I've said before that our normal is going to be a little bit different. I am excited and thrilled that we are moving through demobilization and looking at some other strategies. I think that when you think about where we were 16 months ago, a year ago in March, when you think about what it was in the fall and how hard people had to work, how devastated our businesses have been, we are still climbing out of the rental assistance programs and things you're still seeing. We still have an unmet need for individuals who need to return to work. They can't until they have adequate child care, the housing and the bills. It's going to take a while for our community to fully recover, but every step, and when we said, when I come back to those first press conferences and said, until we have adequate treatment or vaccination, what were our tools? social distancing, wearing a face covering, hand washing, staying home when you're sick, and at one point, staying home, period. Think about where we are today and a sense of hope and optimism, but it's going to require all of us to really get as many people vaccinated as possible. And I think that's the challenge. So I have a sense of hope and optimism. I recognize that things will not be, our normal will not be what it was pre-pandemic for a while. We have a certain percentage of our population, like young children, think about our infants all the way to our 11-year-olds, right, that can't yet get vaccinated, so it's up to us to protect them by vaccinating. You heard the mayor talk about his young children, but that is why it's so important for adults in our community to vaccinate.
Thank you.
Thank you, and we'll be bringing the bus by. Thank you, have a great day.